The following is a video that outlines the proper way to clean and disinfect. Brought to you by TotalCare, makers of CaviWipes and CaviCide. 1 out of every 20 people who end up in the hospital this year will contract a healthcare-associated infection, or HAI. A staggering 1.7 million HAIs are reported in the United States every year. According to the Centers for Disease Control, 99,000 people die from these infections annually. Knowing the enemy is the first line of defense in keeping HAIs at bay. The CDC has identified the 10 most common pathogens found in healthcare facilities. They're responsible for 84% of all healthcare-associated infections. These pathogens include multi-drug-resistant pathogens like MRSA, VRE, E. coli, and P. aeruginosa. Having a product that can disinfect thoroughly enough to wipe out pathogens is imperative to keeping HAIs out of your healthcare facility. In this video, we'll walk through the steps necessary for proper surface cleaning and disinfection so you can protect your patients, your staff, yourself, and your loved ones. Let's make sure you don't take your work home with you. A critical step in properly disinfecting your workplace is knowing the level of application needed for instrument and surface disinfection. As represented in this table, high-level disinfectants are used for heat-sensitive, semi-critical medical devices. Intermediate-level disinfectants can be used on non-critical instruments and environmental surfaces. And low-level disinfectants can be used on non-critical instruments and environmental surfaces. They are typically labeled hospital disinfectant, without the tuberculocidal claim, because they lack the potency to inactivate mycobacteria like TB. Mycobacteria like TB has the highest intrinsic level of resistance among all vegetative bacteria, viruses, and fungi. This means disinfectants with a TB claim on the label are considered capable of inactivating a broad spectrum of pathogens, including much less resistant microorganisms, such as bloodborne pathogens. This broad spectrum of capability is the basis for protocols and OSHA regulations that indicate the use of tuberculocidal chemicals for surface disinfection. Step 1 for any disinfecting process is cleaning. The CDC states, the actual physical removal of microorganisms in soil by wiping or scrubbing is probably as important, if not more so, than any antimicrobial effect of the cleaning agent used. What does this mean? It's simple. Thoroughly clean surfaces before disinfecting. Make sure all organic matter, salts, and visible soil are removed from all surfaces as a first step. This is your key to success. Step 2 is disinfecting. Make sure you not only use a fresh, pre-saturated wipe or disinfectant liquid on surfaces, but that you apply the disinfectant for the recommended contact time listed on the label. And remember to reapply if needed, to keep it on the surface for the recommended contact time. CaviWipes and CaviCide will clean and disinfect TB in just 3 minutes, and MRSA, HBV, HIV-1, and HCV in just 2 minutes. On occasion, you might have large volume spills or debris. The CDC and OSHA recommend prompt removal of blood or body substances. You should first remove visible organic matter with absorbent materials, and then clean and decontaminate the area as outlined previously in this video. Using ready-to-use CaviCide and pre-saturated CaviWipes can help you avoid these contamination issues and assure your choice of disinfectant does not become a breeding ground for pathogens like P. aeruginosa. So remember, Remove any large volume of body fluids or body substances with absorbent materials. Next, thoroughly clean all surfaces of any organic matter, salts, and visible soil. And finally, use a fresh, pre-saturated wipe or disinfectant liquid on surfaces for the recommended contact time listed on the product's label. Put your total trust in TotalCare. Use the trusted brands CaviCide and CaviWipes. Go to KerrTotalCare.com/clean to request a free sample.